We have seen lower case counts of the coronavirus in Philadelphia in the past week. I'm going to discuss those and also going to discuss news on the vaccine, then this new variant of the virus that's appeared in the United Kingdom, and then an update on our safer at home restrictions. And I'm going to take a little bit longer than usual because I have a lot to cover. First, the numbers. Since this time yesterday, we've identified 928 new cases of the coronavirus in Philadelphia residents confirmed by the PCR test, bringing us to a total of 86,723 cases since the beginning of the epidemic. And in addition, there are 97 new probable cases diagnosed by the rapid antigen tests. Now, in part, that large number, 928, is because we received a very large number of laboratory results today, almost 17,000. And for the past week, December 13th to December 20th, we averaged 581 cases per day. So far, we expect that number to rise. And of the people tested, 8.1% tested positive. Now, both those numbers are lower than the week before. The week before, we averaged 905 cases per day and 11.4% testing positive. So these are still very high case counts, but they're clearly falling after the spike caused by Thanksgiving. Now on to deaths. I have to report sadly today that we have 89 newly identified deaths from the coronavirus in Philadelphia residents, bringing us to a total of 2,312 since the beginning of the epidemic. Now, we did expect that deaths would rise after we saw the rise in case counts. We knew that was going to happen after a delay, and that's exactly what's happening now. Now let me talk about the vaccine. As you probably know, the Moderna vaccine was approved by experts on advisory committees at the FDA and the Centers for Disease Control over the weekend. The Moderna vaccine is very similar to the Pfizer vaccine in its design, in its effectiveness, again, 95% effective, and in its safety. It's given in 2 doses, 28 days apart. Unlike the Pfizer vaccine, it's 2 doses, 21 days apart. Now, the Moderna vaccine comes with one very big advantage in that it doesn't need to be stored ultra cold. It can be stored over the long term at a regular freezer temperature, and then can be stored for up to 30 days in a refrigerator before it's used. That vaccine will be shipping to Philadelphia this week if it hasn't arrived already. Now, last week, we were getting the Pfizer vaccine only, and we received 13,650 doses here in Philadelphia. As of this morning, we have documented vaccination of over 9,000 people with those doses. This week, we have been allocated 9,750 doses of the Pfizer vaccine and 27,600 doses of the Moderna vaccine. We'll be giving that vaccine to healthcare workers. We'll be continuing to have that vaccine available in hospitals, but also expand to other sites to reach non-hospital-based healthcare workers such as home health aides. Now, I do want to correct 2 errors that I made when I did the press conference last week. The vaccination of nursing home staff and residents will start next week, not this week, and will involve the Pfizer vaccine, not the Moderna vaccine, at least at first. Now, for the next 4 weeks, we've been told to expect about 10,000 doses of each vaccine per week. If so, we would receive a cumulative about 130,000 doses of vaccine by mid-January. Now, the groups of people to be vaccinated in our first group, that's phase 1A, are healthcare workers and nursing home residents. And there's more than 100,000 people in those categories. And the CDC Advisory Committee made recommendations over the weekend for who's in phase 1B. That includes people over the age of 75, and about 100,000 people who meet that definition in Philadelphia. And then frontline essential workers, sort of people who are in contact with the public day in and day out, and through that have a risk of acquiring the infection and passing on the infection. And that group includes police officers, firefighters, teachers, both teachers in schools and daycares, grocery store workers, corrections officers, U.S. Postal Service workers, and public transit workers. We estimate that there are about 50,000 frontline essential workers here in Philadelphia. And that's 1B. Then we move on to phase 1C. And in general, phase 1C likely will include people who are at risk of serious illness because of age or medical conditions. So these are the recommendations from the National Advisory Group. We will review those here, discuss that with our local Vaccine Advisory Committee, and establish a local list for priorities in phase 1B and phase 1C. Now, a couple of important notes here. At the current rates at which we're receiving the vaccine, we will be in phase 1A until mid to late January. There's a lot of people in that group, and there's only so many doses of vaccine that we're receiving. And then phase 1B is a very large group. It'll take some time for us to get through that. How long is unknown, because we haven't been given any information for how much vaccine we'll receive after the next 4 weeks of shipments. The big picture here is that everyone in the city of Philadelphia who wants to get the vaccine will ultimately be able to get the vaccine. But overall, it's going to take a long time. It probably will be months before this vaccine is widely available to people who don't meet these specific risk categories. Now let me talk about the new variant of the virus. As you may have heard over the weekend, there were reports of a new variant of the virus that arose in the United Kingdom. And it appears, this virus appeared at a time when case rates were surging in the United Kingdom in December. Now, some experts believe that new variant is more easily spread than the variant of the virus that's circulating here in Philadelphia now. So if that's true, and if that variant appears in Philadelphia and becomes prevalent in Philadelphia, that would not be good for us. More people would become infected. But it's not clear that this virus, this variant, is actually more easily transmitted. Right now, it's simply speculation. And there are other possible reasons for the surge in infections in the United Kingdom right now. And this variant should not cause a more serious infection in the people who get it. There would be no more serious than the current version. And the virus should still be prevented, that infection should still be prevented by the vaccine. So there's a lot we still need to know about this, and we'll need to just simply follow the story at this point. Now let me move on to our safe at home restrictions. When we announced those restrictions in Philadelphia on November 16th, our case counts were more than 700 per day. And more important, the case counts were rising exponentially, about 4% per day. And we projected that if case counts continue to rise at that rate, our deaths would possibly exceed 200 per week before the end of the year, and our hospitals might be overwhelmed. Those restrictions, as you know, closed indoor dining at restaurants, sports, museums, gyms, and various other settings. Now, those restrictions, I have to acknowledge, have not been easy for the people involved. I recognize they've been tough. I want to thank those people who've been hit by the personal and financial consequences of those restrictions. But since then, we clearly have made progress, and there's evidence that those restrictions are working. I want to show you that evidence by showing a graph that I have here. I'm going to share my screen here, so bear with me. I'm hoping you're seeing on your screen now a graph that shows case rates in Philadelphia and Pennsylvania as a whole from November 1st until today. The red line shows case rates in Philadelphia, and the green dashed line shows case rates in Pennsylvania. And this red vertical line here is November 20th, the date that the restrictions were put in place in Philadelphia. And the green vertical line here is December 12th, the date in which the restrictions were put in Pennsylvania as a whole. As you can see, when the restrictions went in place, Philadelphia had case rates that were higher than Pennsylvania, and our case rates started to fall after that. Now, Thanksgiving took place on November 26th, and about 5 days later, about one incubation period later, there was a big increase in case rates, both in Philadelphia and Pennsylvania as a whole. After that surge passed, case rates started to fall in Philadelphia, but not so much in Pennsylvania. And during this period when we had restrictions in Philadelphia, but not Pennsylvania as a whole, overall case rates rose 9% in Philadelphia, but 66% in the state as a whole. Since December 12th, when the restrictions have been statewide, rates have fallen in both Philadelphia and the state as a whole. In Philadelphia, they've fallen a little bit more, 27%, in Pennsylvania as a whole, 15%. So I suggest that these restrictions helped limit the rise that occurred during November and has helped accelerating the fall that is occurring in December. Now, when we put them in place, we were concerned that hospitals might be overwhelmed. This is a graph of the number of people with COVID hospitalized in Philadelphia hospitals by day, going back to the beginning of the epidemic. You can see on the left side of the graph that at the peak in the spring, about 1,000 people were hospitalized with COVID at one time. Our hospitals handled that, but they were under strain. Then in November, towards the right side of the graph, when we put the restrictions in place, the number of hospitalized patients was rising very rapidly. And we were very concerned that it might be surpass 1,000 or even get to 1,200 or 1,500, in which case our hospitals really might be overwhelmed. Since our case counts have been falling, though, this number has first stabilized. In the past few days, it's actually falling as well. So evidence that the restrictions we put in place have had this effect on limiting the potential risk to the hospitals. So with that in place, though, still there are many reasons for us to be worried. In Philadelphia and in Pennsylvania and the U.S. as a whole, case counts and death rates are still near record highs. There are models that can say that if we were to ease back on all of our restrictions now, it could lead to some 9,000 additional deaths in the state of Pennsylvania before April 1st. And if that increase was proportional, that would mean 800 additional unnecessary deaths in Philadelphia before April 1st. Now, we've seen that holiday gatherings can cause a big increase in daily case counts. We saw a small increase after Halloween and a very, very big increase after Thanksgiving. You see that holiday effect can last. People who are infected over holidays then pass it on to others, who then pass it on to others. The Thanksgiving spike lasted about 10 days, and the case counts are still likely higher than they would have been if we didn't have the Thanksgiving spike. So we're hopeful that case rates will fall for the next week, but we do have big holidays coming up. We have Christmas and we have New Year's. We'll begin to see the effect of Christmas in the last few days of December. We'll begin to see the effect of New Year's on about January 5th. These two spikes will likely run together and unfortunately may feed off of each other. We won't likely see the end of them until about January 15th. Now, currently, the safer at home restrictions in Philadelphia are set to expire on January 1st. And as of now, the state restrictions are scheduled to end on January 4th. Based on the data and the spikes following the holidays, we believe it's too risky to end all of our current restrictions on either January 1st or January 4th. We need to get past that spike before it's safe to back off. Now, businesses in the past have asked us that we give them adequate notice before changing our restrictions so that they can plan. That's a fair request. So we're announcing today a change in the expiration date. We will maintain the current restrictions for the riskiest settings through January 15th. By riskiest settings, I mean indoor dining at restaurants, indoor gatherings and events, theaters, casinos, colleges for in-person education, and indoor organized sports. It's based on these activities, number one, being indoors, number two, involving either large numbers of people or long periods of time with those people together, or people not wearing masks, or more than one of those. Now, if the case rates don't rise more than we expect them to rise, we will still allow the somewhat less risky settings to restart when the governor's restrictions expire on January 4th, or later if the governor were to extend those restrictions. That means allowing museums, outdoor sports, gyms, high schools for in-person learning and outdoor catered events to start on January 4th. But the restrictions on how they there would still be restrictions on how they operate. Those restrictions would remain in place for all of those. Most important for all indoor activities, including gyms, masks would have to be worn at all times. And in general, for indoor activities, our density has to be less than 5 persons per 1,000 square feet. Now, let me go back to restaurants for a minute. We know this is extremely difficult, and this is through no fault of the restaurant owners. But the nature of the situation simply makes that inherently risky. As the pandemic has unfolded, we see more evidence that the virus spreads through airborne routes. We're less concerned than we were earlier on about spread through objects and surfaces, but we're more concerned about spread through the air. Now, they're both good and bad aspects of this. One thing is clear is that even a 6-foot distance is not enough if ventilation is not good and people are not wearing masks. But when there are high levels of ventilation, the risk can be greatly reduced. That's why the experience has been that outdoors is much safer than indoors. People getting together indoors when they're not eating, and because they're eating, not wearing masks, is the riskiest setting of all. And that risk is going to remain until the vaccine makes this epidemic go away. So we're working with the restaurant industry to reduce that risk. Outdoor dining is continuing, and we're focusing now on improving ventilation indoors to reduce the risk of airborne spread indoors. We want to see if there's a way we can assist restaurants citywide in meeting a very high standard for ventilation, and then verify that they're meeting them, and provide funding for the cost of meeting them. Now, we haven't put that in place yet, but we hope to have that in place by mid-January. In the meantime, the city is providing funding for restaurants. We understand that funding is very limited. It's not as much as the restaurants are losing by any means, but it's what the city can do right now. Then there's the federal relief funding for businesses that was now passed. I don't know the details yet, but I'm hoping that there is significant relief in there for restaurants. So that's with restaurants. What about individual people in Philadelphia now? What should they do? Well, remember, this is still a very high-risk period, and we have the holidays coming up. So no indoor gatherings, no indoor dining, no indoor sports, gyms, museums, libraries right now. If you do want to get together with other people, do it outside with everybody wearing masks. We're asking everyone to follow these recommendations. We can't afford to have more case spikes like that Thanksgiving spike. Don't travel over the holidays. Celebrate your holidays with your immediate household members only, the people you live with every single day, not with relatives and friends who don't live with you. It doesn't matter if you've been tested and they've been tested. It's still not safe for you to get together with people outside of your household. We know that's really difficult during this holiday season. That goes against all of our traditions, but we don't want to pass on COVID. You don't want to pass on COVID to your grandmother. Don't make that mistake when we're so close to the finish line now. More information on all that we've talked about here is at our website, www.phila.gov/COVID. Thanks.
Good afternoon, Dr. Farley. How many people do you hope to have vaccinated by the time that these restrictions lift? And can you talk a little bit about how that number plays into your decision about whether or not to keep certain things implemented?
Well, we hope to deliver as much vaccine as comes to us. I estimated that by the mid-January, we'd be probably over 100,000 people vaccinated. Unfortunately, that's still a very small fraction of the city of 1.6 million people. And the same group that models the effects of different implications, different interventions on the epidemic, modeled what happened if you accelerated the vaccination program. And it really didn't have that much impact on the number of deaths. It's simply that this epidemic wave is occurring too early and the vaccine is coming out too slowly. So that's why we're relying so much on restrictions now. The vaccine will ultimately reduce the number of people dying, but certainly not in the next few weeks and maybe not in the next couple of months.
In terms of the stimulus, sir, how much money is the health department going to get for vaccine distribution? And do you think it's enough?
I don't know the answer to that. We're very eager to find out.
I know you needed some money.
I don't know if Rob wanted to weigh in. We have Finance Director Rob Dubow here.
Yeah, it's too early to tell. It's a multi-thousand-page piece of legislation, so we'll work through it. We know that there is money nationwide for vaccination and contact tracing. We'll be a little while before we know how much comes here.
And Mr. Mayor, one quick question for you. Do you have any idea at this point how many businesses have closed citywide since March and what exactly the ramifications and lost taxes are?
Well, the ramifications are going to be severe. I don't have the number. We don't know exactly how many, because those who have closed, we don't know if they're going to reopen or not. So I don't know whether Commerce or Finance has any more information, but I don't think we'll really know until we start getting back to normal and see who reopens.
And Mike Rashid has joined us, the Commerce Director.
That's correct, Mayor.
Thank you.
Just don't know.
And I can tell you about the impact on revenues. Our initial projections and what we built our budget on were that we would lose $750 million in tax revenues by the end of this June. So far, those projections are looking like they're accurate, although the numbers could get worse if the economy doesn't pick up between now and the end of the year.
Thank you all.
Thank you, Mitch. Let's go now to Alicia Reed of CS3.
I have two questions. One is about coronavirus and the other one is about mummers. Do I ask the first one and then come back later for mummers?
Why don't we just try to squeeze them both in, since obviously the mummers were impacted by COVID. That is certainly related to this topic. So go ahead with both.
So my first question is for Dr. Farley. So people are being urged to stay home for Christmas and New Year's, but if they decide to do exactly what they did, back on Thanksgiving and the numbers skyrocket, do hospitals have enough beds, workers, all of that to accommodate a spike in cases?
Well, there is some availability in the system right now. As you saw in that graph I just showed, we're about 800 people in the hospital. We can handle 1,000. I'm not sure if we can handle 1,200 or 1,500. I'm hopeful that the spike will not be that big, but I can't guarantee that if we have a huge spike that we might not have a problem in hospitals.
Okay, thank you, Dr. Farley. And this one is for Mayor Kenney. Some people are saying that they're still going to march down 2nd Street on New Year's Day. They're not calling it a parade, they're calling it a protest. And so right now it seems, I think there are about 2,600 people that have signed up to attend this protest. And so how is the city going to address this alleged protest come New Year's Day?
Well, it's important to remember that the bulk of the mummers and the organized groups made it clear that they weren't going to march this year because of health concerns. So the major divisions of the parade who are organized made that decision early on. The people who decide that they want to protest or march/protest, we'll try to keep them safe as we possibly can. Listen, I mean, I was in Mummers Parade for over 30 years. It's part of my tradition in life growing up, and I'm disappointed that they're not going to have it either. But it's not more important than your health and your life. So, I mean, I would urge people not to do it. We will certainly have whatever police around to keep people safe. We would urge them not to go out there and put themselves at risk and their families at risk. For 1 year. I mean, we can hopefully, if we get this under control, come back better next year and have a real good celebration. But certainly people have a right to protest, and we'll try to keep them safe. Just if they would wear a mask, that would be helpful, and not kind of breathe all over each other would be also helpful. But we'll see what happens on New Year's Day, and we hope everybody's safe. That's the only thing I am concerned about as mayor, and I know everybody else on this call is concerned about, is keeping people from getting sick and dying.
And the folks that do plan on protesting, they have whatever paperwork they need to do that protest?
No, we're not issuing any permits. We never issue permits for a protest. The protests back during the late May, early June were spontaneous protests based on outrage over what was happening in the country. They were not permitted, but they were not physically permitted, but they were allowed, and we try to keep people as safe as possible. Regrettably, some folks out there during that period of time was doing damage and breaking things up. But that was not everybody out there was doing that. Most of the people out there were protesting for understandable reasons. And if people want to protest New Year's Day, it's certainly their right to do so, and we'll try to keep everybody safe and orderly.
Thank you.
Okay. Thank you, Alicia. Let's go now to David Belandra of Philly Sports.
My question is for Dr. Farley. How would you have all the college and the pro teams have handled so far with all the restrictions and followed all the guidelines you guys have presented to them?
In general, I think that they followed they have good safety standards, and in general, I appear to follow those standards and have done fairly well. It hasn't been perfect, but in general, I think they've done fairly well.
My follow-up for you would be is with these new things you implemented until January 15th, that includes indoor sports events. The NHL season is supposed to start January 13th. The NBA season starts tonight. Are you saying for now, nobody in the arena as for spectators?
Correct. No spectators. Now, those sporting events are allowed to take place. We have exceptions for professional sports where they send us individual safety protocols. We negotiate them and we approve them. And so the sports can take place, but no spectators.
All right. Thank you very much.
All right. Thank you, David. Let's go now to Laura McChrystal of the Inquirer.
Hi. Dr. Farley, I'm wondering how you decided which events or which activities would be able to resume January 4th versus the 15th. I know you mentioned indoor dining is especially risky, but for example, like the difference between theaters and museums, how did you make those distinctions?
Difference between what and museums?
I believe you had theaters cannot reopen, but museums can.
Yeah. So we looked at several factors. We looked at the number of people involved, whether it's indoors or outdoors, whether people are likely to be wearing masks, and the amount of time that they're together, and whether there's evidence of from elsewhere or here of outbreaks in those settings. Museums, I'm not aware, or there's evidence of the outbreaks. You can have pretty low density in museums. People can certainly wear masks in museums. They are indoors, so there is definitely some risk there. But theaters, there definitely have been outbreaks that have occurred in theaters. There tend to be more people, they're a long period of time, and so they're higher risk. Wherever you draw the line, there's going to be ones close to the line where you question whether that's the right judgment. But we try to be as objective as possible in determining what were the riskier ones.
Okay. And at what point would you determine, you had mentioned that you may need to change course if the spike is bigger than expected. At what point would you make that determination prior to January 4th?
I can't say the date on that. I think the point here is the epidemic continues to surprise us. There's so much that we are going to have to always act on in the future based on information in the future that nothing is a guarantee. So I'm hopeful that those activities that we have listed will be able to open on January 4th. And that's even taking into account the fact that we expect some increase for Christmas and New Year's. But I'm hopeful that we can still do that. But the riskier ones, we want to postpone those until January 15th. Even the fact that we're going down now doesn't make us comfortable because we do expect that spike.
Okay, and my last question, the large number of deaths that you reported today was, I know they're delivered in batches, but I'm wondering, is that kind of on track with what you've been expecting? I think last week you said you expected to reach 100 deaths a week by the end of the year.
That is about on track with what I'm expecting, unfortunately. I'm hopeful that we can keep them under 100 per week. We didn't get many reports during the week, so that 82 represents about a week's worth. So that's under 100. We'll see where we go from here. When we made our restrictions, I was concerned that maybe over 200 per week. So if we can keep them up under 100 per week, that's still way too many, but that is real progress.
Okay, thank you.
Thank you, Laura. Let's go to Isabel Sanchez of Telemundo.
Hello. Armando, estos permisos para que los restaurantes estén ofreciendo el servicio de comida al aire libre, ¿se van a extender entonces, ya que las limitaciones de comida al aire libre van a tener que ser la única manera para ellos poder ofrecer el servicio?
The question is probably directed to Commissioner Farley. These permits for restaurants to offer open-air service, are they going to be extended? What would restaurants have to do in order to get those done?
So restaurants are allowed to have outdoor dining now, and they will continue to be allowed to have outdoor dining. Is that the question?
Y si esa es la pregunta sobre si los restaurantes van a continuar con el permiso para poder ofrecer comidas al aire libre.
Sí, pero sé que la ciudad requería algunos permisos para ellos estar en parte de las calles o cerrar parte de las aceras. A eso es que es lo que me refiero.
Then the question may be best for the mayor. Our colleague is asking about the permits that the restaurants are required from the city in order to offer service that it's outdoors, curbside, or taking over some of the sidewalks. The permit issue is the question.
The permit, I don't understand the question.
I think
Hey,
Kumar might be the
Armando.
best to answer that.
Hey, good afternoon. Hey, Armando. The restaurant would have to contact our Department of License and Inspections, and it's a work group. It's an interdepartmental work group, including License and Inspections, Commerce Department, and Streets Departments that work on approving those permits. So they would just need to contact one of those departments to get that started.
Tomar Alexander nos dice que hay un grupo de trabajo, Isabel, que está constituido por gente del Departamento de Comercio, de calles, para aprobar estos permisos, y que lo que los restaurantes tienen que hacer es contactar a la Oficina de Licencias e Inspecciones para obtener estos permisos para ofrecer servicio al aire libre.
Muchísimas gracias.
Thank you very much.
Isabel, are you all set?
Yep, that was all on my list.
Good. All right. We are now going to go to Martin Pratt, and after Martin, we can open the floor for a few minutes for a second round of questions. Martin Pratt of Philly YBN. You're up.
Thank you. Dr. Farley, I know a lot of us are facing COVID fatigue. What are recommendations you have for Philadelphians to stay alert, still deal with what we have to face, wearing masks, washing your hands, but also all this information that's coming out almost on a daily basis? Are there any suggestions you have to go to one website or two websites that can kind of decrease the stress that we're all feeling?
Obviously go to our website where we really try to provide the most objective information and guidance on that. In general, I would go to health department websites, both the CDC, the state health department, our health department. I'm saying in general, I think the media has done an excellent job of reporting this objectively. Now, I wouldn't pay a lot of attention to social media personally, because then you have a lot of conspiracy theories and information that's inaccurate. But in general, the media's been pretty accurate. As far as sort of how to psychologically survive through this, I would just point out, it's okay for people to go outside. You don't need to hide inside. Outside, there's a lot of ventilation, and so you can get out there and you can exercise. You can be with people that you want to visit with, your relatives and your friends, as long as you're outside and wearing a mask. And I think that'll help psychologically for people feeling cooped up. And also knowing that we're not too far from the end of this, that the end is in sight. And that might help people be able to hang in there just a little bit longer with restrictions.
A last question for you, Dr. Farley. Has there been any advances that your office is aware of or is happy to share with actually cleaning the air from, as you mentioned earlier, the most concern we have with restaurants is the droplets in the air?
Well, we do think that the droplets in the air are a risk, and that a better heating, ventilation, air conditioning system, HVAC system, that circulates more air, that has more outside air mixed in it, and that has a filter in it, can help reduce that risk. And we're going to try to make more specifics around that general principle for the restaurants to go with that'll reduce the risk at all indoor restaurants.
Thank you. I'm done.
All right, thank you, Martin. Let's go back to David Melandra of Philly Sports Network.
Dr. Farley, this is a follow-up for one of my other questions for you. Is the small time when there were fans allowed in for the Eagles games and for the soccer games down in Chester, during your contact tracing, were there any relation to that the cases rising from the fans being in the stadiums, because those are their outdoor stadiums?
We definitely had instances in which we identified people who had the infection and were their infectious period, they were at the stadium, or people who were at the stadium during the time they might have been exposed. But it's really hard to tell whether they actually transmitted at the stadium. In general, outdoors is less risky than indoors. I'm hopeful. Now it's getting close to the end of football season, but I'm hopeful in the not too distant future we can allow people to be at outdoor stadiums.
So what's it going to take from the city side to sign off on allowing, say, example, for the Philly season is going to start up in April. There have been talks about the NHL looking to move more home games from indoor arenas to outdoors. What's it going to take, have the Philadelphia Flyers approach to you about moving some of their home games to outdoors?
They have not approached me that I'm aware of. I would be enthusiastic about that. I do think that the risk is much less outdoors. And so I'm hopeful for the upcoming baseball season. And if the Flyers can figure out how to do it outdoors, that would be great.
All right. Thank you.
Okay, thank you, David. And seeing no further questions, this concludes our press conference for today. A reminder, as we announced earlier, we will not be doing a larger COVID availability next Tuesday. However, the health department and Dr. Farley will be doing their own. So you could reach out to Jim Garrow in the health department next week for details on that. We will resume these press conferences in 2 weeks in the new year on Tuesday, January 5th. Thank you.